Turning now to step 4 of our roadmap. We've come to a stage in the pandemic when there is no easy answer and no obvious date for unlocking. We have cases rising significantly with more than 30,000 per day, and we can see what is happening across Europe as the Delta variant takes hold among our friends. We know we're going to see more hospitalizations and more deaths from COVID. But we also know that this wave was clearly foreseen by our scientists when we first set out that roadmap in February. And if anything, so far, we are in the middle range of their projections for infections and at the lower end of their projections for mortality. And we also know that if we were now to delay this 4th step, for instance, to September or later, then we would be reopening as the weather gets colder and as the virus acquires a greater natural advantage and when schools are back. And so we think now is the right moment to proceed when we have the natural firebreak of the school holidays in the next few days. And Chris and Patrick will set out in just a minute how we are meeting the 4 tests for step 4 in England. But it is absolutely vital that we proceed now with caution. And I cannot say this powerfully or emphatically enough. This pandemic is not over. This disease, coronavirus, continues to carry risks for you and your family. We cannot simply revert instantly from Monday the 19th of July to life as it was before COVID. We will stick to our plan to lift legal restrictions and to lift social distancing. But we expect and recommend that people wear a face covering in crowded and enclosed spaces where you come into contact with those you don't normally meet, such as on public transport. We're removing the government instruction to work from home where you can, but we don't expect that the whole country will return to their desks as one from Monday. And we're setting out guidance for business for a gradual return to work over the summer. And as a matter of social responsibility, we're urging nightclubs and other venues with large crowds to make use of the NHS COVID pass, which shows proof of vaccination, a recent negative test, or natural immunity as a means of entry.